knowledge and sound needed for innovation.
Music brings us together, even when we're apart. That's why we support Canadian musicians, festivals, and award shows. It's just one of the ways TD's Ready commitment helps build a more inclusive tomorrow.
Atiga Mackenzie, Labrador Muyungavunga, we acknowledge that this event and the Halifax Pride Festival take place in Mi'kmaq, the ancestral and unceded territory of the Mi'kmaq people. This territory is covered by the treaties of peace and friendship with Wabanaki peoples. We recognize that reconciliation requires action in support of words. We commit to working with and supporting Indigenous communities, and we are committed to identifying and uprooting all systems of oppression. We are all treaty people.
Halifax Pride is dedicated to providing space that is accessible, inclusive, and free from oppression, harassment, and discrimination. In this space, we will treat each other with respect and dignity, regardless of age, race, gender expression, gender identity, sexual orientation, levels of ability, and all our other diverse identities. Halifax Pride stands in solidarity with the Black Lives Matter movement to end police brutality and violence against Black communities across North America. African Nova Scotians and Black people have the right to live free from oppression, violence, and systemic marginalization. Halifax Pride recognizes our history and ongoing contribution to the marginalization of QT BIPOC. Since the beginning, and to this day, the queer movement remains a protest against systems of oppression, including those that disenfranchise Black, Indigenous, and people of color. As such, Halifax Pride commits to actively operating in a more anti-racist and anti-oppressive framework by prioritizing QT BIPOC voices and leadership in our spaces and throughout our festival. Holding ourselves accountable and allowing queer individuals to also hold us accountable for our shortcomings. We commit to engaging in discussion and following the leadership of traditionally marginalized and disenfranchised queer individuals. Supporting Black, Indigenous, and people of color and their leaders in actions calling on government and organizations to take action and adopt policies that create meaningful change. Thank you.
Good morning, everybody. My name is Garry Dart. I am the Health and Wellness Educator at the AIDS Coalition of Nova Scotia. I am so excited to be here to be talking about Undetectable equals Untransmittable, celebrating positive societal attitudes. So my pronouns are he, she, and they. I am very queer, gender fluid, and originally from Newfoundland. I'm living for my new queer mullet and all of that excitement that it brings during Pride. And I'm so excited to be here to talk about this with my three amazing panelists. I know I talk really fast. I'm from Newfoundland. Sorry about it. We have some amazing, amazing interpreters as well. So thank you so much for being here to do that work. I would like to thank Halifax Pride for the land acknowledgement and Black Lives Matter statement, as well as Safer Spaces policy. I think it's really, really important to acknowledge that and to speak out more about what we can do and how we can share that message. So a lot of people might not even know what undetectable equals untransmittable means, or what U equals U means. And so what it means is that when you have an undetectable level of the virus in your body, you cannot transmit it to anybody else. So U equals U is a really, really important message for not only people living with HIV, but for people that have a lot of stigma towards people living with HIV and really don't know much about it, aren't educated about it. So that's really important. It's a really important message that we need to share, and I'm so happy that we can talk about it here. I was really lucky to be able to speak about it all last fall, all last year. I did a lot of national and provincial work. Some of you may know me from the Slay Stigma Canadian Tour with Trinity K. Bonet from RuPaul's Drag Race last fall. It was so fun. I'm glad that one of our panelists, Deva, was there and did an amazing, amazing job. So thank you so much, Deva. And I'm so excited to be here working with you again. So thank you very much for that. And that's enough about me. I think we can move right on to Deva Station. So many of you know Auntie Deva, the sparkling diamond of Halifax, is the old girl of the city and loves to help out the new generation in any way that she can. Old school polish and glamour. Over the years, she has been involved with just about everything and remains a standard in the community. Thank you so much, Deva.
It's a fun way of saying old. Yeah, hi, I'm Deva Station. I've been HIV positive for, I think it's 5 years actually in September. And I never thought that I would be here. When I first moved to Halifax, HIV was my biggest fear. It was like a country boy coming here, fresh off the turnip truck, like a new gay smell. And I was terrified of HIV. But I fell right in with the drag queens and a lot of who were positive. And I kind of forgot about it because I saw it in the beginning when it wasn't becoming so much of a problem. Yes, I had seen girls, come and say, "You girl, I got 2 T cells left." I had seen that, but I saw it grow away from that as time progressed. And but then when HIV found its way to mommy's house, I'm not gonna lie, I had a complete and total nervous breakdown. I didn't want to be on this planet anymore. And my greatest fears had come to life. And but I can honestly say it that that's where I was at my very, very bottom. But it helped me grow a focus, and it helped me. I thank my husband for it now, because it helped me grow and become as a new person and gave me a focus. And now I've lost my complete train of thought. So, but I'm very lucky. When you talk about stigma, I'm very lucky that I am in a relationship, because I have seen firsthand, on places like Grindr or Manhunt, if somebody puts positive on there, they are literally, chased away with an axe, and they are told that they are dirty and no, get away from me. And they don't understand. And these are gay men who don't understand the fact that I can't give it to you, Merle. Like, do you understand that? I am safer than anybody else, So the stigma has never affected me, but I know that I am terrified if anything ever happened of being put back out in that world, because it is there. and we had to get rid of that. So is that a good introduction? Was that okay?
That was amazing.
Oh, well,
Yeah,
thank you.
So good. I love that. And so when I met you last year, like when you came out on stage and, you know, said publicly that you were living with HIV on tour, like that for me was probably the top highlight of the whole tour. It was spectacular.
It was Trinity. She was amazing. She was
Yeah.
really amazing, and she kind of gave me that strength. And I had wanted to do it, and I said, "Oh, I'm going to do it there." And I had kind of forgot about it, and then I had to go back and put it back up. I was very flabbergasted, but that was amazing. Like just having that opportunity to do that, and I got so much love. Like I got love from people who I never thought I would get love from, and HIV it's really not that bad. Yvonne, I always say, Yvonne was, she's one of our ID nurses here, and she's actually retired, but she's been there the whole time, you know, right from the very beginning here. And when I first became undetectable, because that was my goal. It's like, if I don't get there, that's it. I'm done. And when I finally did, she said, "You are really low." She said, "I don't know, we got you really low." And I was like, "Good." And I said, "So it's not in me anymore." I said, "So basically, you can think of it, you're kind of cured, right?" And she said, "Well, we could find it in your brain." She said, "If we cut up in your brain, we could find it." She said, "But just think it like this." She said, "It's in a little room locked away in your head, and it's surrounded by a moat and guard dogs. And as long as you take these 2 little pills every day, it ain't never going to get out," right? And I'm like, "Okay, I can live with that." So, and now it became my focus. And I'm actually that person now that new young little ones who are newly infected, they came to me. And that, oh my God, I'm going to cry. That was my total healing point right there. It's because, okay, I'm now that old girl who has it, who the young ones come to, that, you know, I'm that Auntie Deva that I can help them. And that's been one of the best parts of all of this journey that I've been on, and has helped me become, I like the person I am. And I have HIV to thank for it, because it really gave me a focus. So
Amazing.
I'm going to cry now.
You're allowed.
Okay.
Thank you so much.
You're welcome.
I have to, you know, shout out to everybody from last year that I worked with and everybody this year. You know, working at the AIDS Coalition of Nova Scotia, I get to talk to and interact with and learn from so many amazing people, and, you know, Deva included. And, you know, I work a lot with Kirk and with so many people here in Halifax and throughout the province. And I feel very privileged. And I do want to shout out to Randy Davis, who is one of my very best friends, who I was on tour with last year. He has educated me, particularly about HIV, more than anybody else. And I just want to say thank you so much for everything that you've done for me and all of the education that you've given for me as well. So next up, we have OmiSoore Dryden, who lives and works in Jabuktuk, or Halifax, the site of the oldest Black communities in Canada and current home of African Nova Scotians. OmiSoore is a Black queer femme whose scholarship focuses on the lives of Black people and addresses the health inequities we continue to fight against. Dr. Dryden is the James R. Johnson Chair in Black Canadian Studies, Faculty of Medicine and Associate Professor, Community Health and Epidemiology at Dalhousie University. Dr. Dryden is an Associate Scientist with the Maritime Spore Support Unit, or MSSU, and a current member of the International Black Feminist Health Sciences Studies Collective based at Northeastern University. Dryden is an interdisciplinary scholar who examines the symbolics of blood and the social life of blood donation, while engaging with Black queer diasporic analytics and health and medical humanities. Dr. Dryden is the principal investigator of #GotBloodToGive, #DuSang-A-Donner, a research project which seeks to identify the barriers African, Black, gay, bisexual, and trans men encounter with donating blood, and also analyzes how anti-Black racism, colonialism, and sexual exceptionalism shapes the blood system in Canada. Thank you so much. You can go right ahead.
So, can you hear me?
Yeah.
This is the question you must ask all the time when you are on Zoom, after being reminded yet again that your mic is still on. So yes, I do want to start with a bit of a modified land acknowledgement. We work and live in Chibuktuk, Halifax, the traditional unceded territory of the Maliseet, whose ancestors, along with the Mi'kmaq and Passamaquoddy nations, signed peace and friendship treaties with the British Crown in the 1700s. We must continue to note that this was 140 years before the end of slavery in Canada, and that, as far as I've been able to tell, enslaved African people were not written into these treaties. So we need to be really cautious about claiming that we are all treaty people. Halifax was imposed upon Chibuktuk in 1749, and enslaved African people were used to dig out the roads and build the city, including much of the citadel. And on the southern shore of the Bedford Basin, Mi'kmaq folks shared land with Black people, and this allowed Africville to be founded in the mid-1800s. And so I say this because it's also important to disrupt the idea that Black people are settlers. They are not. African Nova Scotians just didn't go and purchase this land and then create Africville, that this was part of a negotiated agreement with Mi'kmaq folks, and that we also need to rethink how we understand the settler indigenous dichotomy, because if we just use those two toggles, it often excludes Black people, which is a form of anti-Blackness. And so, this is the second panel I'm speaking on for Pride, and it's the second time Pride has read the land acknowledgement, and the second time they've claimed that we're all treaty people, and we are not. So we need to really, if we are committing to Black Lives Matter and addressing anti-Black racism and making sure that we're all included, then we also need to make sure that we're really specific around understanding how slavery and colonialism and treaties are all happening at the same time. So my work really focuses on blood and blood donation, as you said. And my project, funded by Canadian Blood Services, was the only one that focused on Black gay and bisexual men, including cis and trans men. And so I say this because much of the work on HIV and AIDS in Canada has excluded Black people. Black gay and bisexual men are often only considered a risk group and not really thought of outside of HIV and AIDS in that way, nor thought of as, Black people are rarely thought of as just being healthy. And we see this repeated in blood donation. And we see this repeated in the kind of stereotypes and stigma that are surrounding and embedded in HIV and AIDS. In the early 90s, right when ACT OUT was beginning, what we started to see were predominantly white gay and bisexual men claim that they were victims of AIDS that was created and started in Africa and perpetuated and shared by African people. And so those kinds of stereotypes still remain today. People are like, oh, AIDS started in Africa, without any real kind of critique in terms of how that just perpetuates a racist stereotype and bias. We also saw how that bias was embedded in the criminalization of HIV and AIDS when it was predominantly Black men who were being charged with the criminalization of HIV. So in Canadian Blood Services, as many of us will know, we heard a lot about gay blood activism, but that activism has also become predominantly really white, without focusing on how the history of anti-Black racism and blood donation in Canada also therefore impacts Black gay and bisexual men. And so while there may be some movement to include gay and bisexual men as blood donors, what that does not do is address the continuing histories and presence of anti-Black racism in the blood system in Canada, which means that gay blood activism as it currently exists really isn't about all gay people. And we've seen this identified in the ways in which gay blood activism has from the beginning, did not address the impact that the blood donor system was having on trans people. And prior to Canadian Blood Services specifically writing in a question on the donor questionnaire about one's trans identity, there were questions on the donor questionnaire prior to that that also operated in excluding trans people. And so I think if we really, so that's, just some pieces around blood donation, and I'm happy to talk in more detail around what's happening there. The other piece I want to address is the ways in which Canadian Blood Services are not prepared for PrEP and the inroads that PrEP has been making in our communities, nor has it resolved how to address U equals U. So Canada signed on to U equals U. As much as Canadian Blood Services has been asked about, well, what does this mean for blood donation? If people are undetectable and therefore makes them untransmittable, then how do we rethink, gay people as blood donors? And Canadian Blood Services really isn't about that. They're not about that life. They're not about trying to address that. And so the federal government then is in a quandary if, we can really question whether or not they are committed to U equals U when agencies that are funded by the federal government, and Canadian Blood Services has funding not only from the federal government, but from various provinces and territories. What does it mean when agencies that are funded by the federal government are refusing to take up the commitments made to U equals U? And then the other piece I want to talk about is PrEP isn't available to all gay men, all gay bisexual men, or all folks. The ways in which anti-Black racism work in health and medicine means that Black, gay, and bisexual men don't have the same kind of access to PrEP in the same kinds of ways that many other people may have. There's a reason why the Black Coalition for AIDS Prevention in Toronto started, and that was because the AIDS Committee of Toronto wasn't actually addressing the concerns that Black, gay, and bisexual men were experiencing and having. And in fact, the AIDS Committee of Toronto would often compete with the Black Coalition for AIDS Prevention in funding, in accessing funding, often going for the same dollars that Black CAP was going for, as opposed to working in partnership with Black CAP, and in essence, taking funds out of the hands of Black, gay, and bisexual people. And so I just want us to identify that if we really, it's not enough just to kind of read a statement and say, we support Black Lives Matter. There's a scholar by the name of Sarah Ahmed who speaks about the ways in which performing something doesn't actually affect something. So, and she's talking specifically about universities, that universities will claim that they have a commitment to equity, diversity, inclusion, and feel that that's the extent of the work that they need to do, that they don't actually need to disrupt any of the systems that continue to perpetuate harm. And I would say that for Pride as well, and for those of us who are in this work, that is not simply enough just to say, we support, BLM, or we support, addressing and confronting colonialism, when in the work that we do, we are not also speaking about how that work is informed by white supremacy and works to continue to marginalize and harm not only Black people, but Black and Indigenous people and people of color, and Black and Indigenous people and people of color who are queer, trans, two-spirit, gender nonconforming, bisexual, and questioning. So I'll just leave it there. Thanks.
Thank you so much. I think you brought up a lot of points that I really want to come back to after our next panelist goes, and we have more of kind of an open discussion, and hopefully we get some comments from people that are viewing. So please send in your comments and questions. We really want to be able to answer those for you. They can be specifically for one of the panelists, or they can just be a general question to all of us. We have somebody moderating that, so please send in your questions. We're really excited. So next up, we have my friend, Kirk, who uses he, him pronouns. Kirk is a white settler living in Mi'kma'ki. As the Atlantic Regional Manager with the Community-Based Research Center, he oversees CBRC's programs and initiatives across all 4 Atlantic provinces. I'm doing really good with my English here this morning. Kirk has worked in 2S LGBTQIA plus health for over a decade and holds undergraduate and graduate degrees in health promotion. Go ahead, Kirk.
Hi, good morning, everyone. I'm the last one you've heard from today, and I have to follow OmiSoore, which is not an easy task. And I am here in my lovely rainbow shirt, which I bought just for Pride. Thank you, Joe Fresh at Superstore. I have a couple points that I want to address. So just a little bit about the CBRC. We were founded by white cis gay guys, and that was our focus for a long time. And I would argue it probably still primarily is just because that's a lot of who we are. We are expanding our services, of course. One of the big things we do is a survey called Sex Now, catch your eyes. It's a survey of queer men across Canada. I would love to say we run it on a regular basis, but it's basically whenever we can manage to get funding. We've been very fortunate that we did an in-person event here at Halifax Pride last year. No, not last year, in 2018. Oof, time is flying. We did an online version in 2019, and we were going to do another in-person event during this year's Pride festivals, but we know why that didn't happen. Thank you, COVID. So in 2018, we partnered with the AIDS Coalition of Nova Scotia to do hand up paper surveys and do what's known as dried blood spot collection. Much like Dr. Dryden, we were also funded by Canadian Blood Services. We had about 200 people participate. The blood ban was obviously a key focus of our work. I was one of the people doing dried blood spot collection. So what that means is that I got to crouch over and hold a little tiny piece of paper up to people's fingers and try to collect their blood as it dripped from their fingers. Fun thing to do for 12 hours. One of the things that most impacted me during that time, because we had an event right after the parade and one during the dance night. I can never remember, it's the bump and grind, whichever it was. A gentleman came in, he had been working during the parade in the afternoon, so he couldn't come in during the day. He paid the cover just to come in, just to do this study. Because when he was younger, before he came out, before he was sexually active with men, he and his dad used to go and donate blood together. That was a bonding thing for them. So he really wanted to fight the blood ban. And that is like an anecdote, but like if you want the numbers, 90% of the people in Nova Scotia who participated, and again, primarily queer men, we did have trans and non-binary participants as well, but primarily queer men, 90% said they would donate blood if they could. And in our 2019 National Online Survey, and look for the 2020 online survey coming soon, we asked a lot of questions about undetectable equals untransmittable, so U equals U. I would argue the third U is that it's undeniable. All the scientific evidence supports it. But the community, 85% of our participants knew that HIV treatment could lead to undetectability, and 77% of our 2019 participants knew the message of U equals U. So that's pretty good. It's not perfect. There's still room to go. But I also want to point out that it's not only a gay men's issue, but sadly, gay men and queer men and other men who have sex with men are heavily represented in the HIV stats. So there have been lots of campaigns to raise the awareness. I studied public relations, so I know you need different tactics for different people. The goal is really just to reach as many people in as many ways as possible. I have a friend that I called my old married gay friends, which they don't like because they're the same age as me, but they've been married for like 15 years and they're like all domesticated with kids and they live in the suburbs. They know nothing about PrEP and U equals U, so there are still lots of pockets of people to reach. As Garry mentioned, Garry led the Slay the Stigma tour across Canada, 30 shows in 30 days or something along those lines.
Yeah, it was wild.
No, thank you. But there are other campaigns. I'm on the board of directors for the Canadian AIDS Treatment Information Exchange, which we abbreviate to CATIE, C-A-T-I-E. So they launched a campaign last fall called Can't Pass It On, with interviews with a series of, a diverse group of couples where one partner was HIV positive and one was not. And I liked it. Although I have heard the criticism that, it's a bit chaste, like, if we're talking like for the gay couples, we're talking about gay sex and like you get like a little peck on the cheek and that's the entire representation of gay. So barriers still exist. I think we have a lot of entrenched thinking about HIV. I came out in the mid-90s before highly active antiretroviral. I'll give the interpreter the moment on that. before before highly active antiretrovirals were common. At that time, AIDS was essentially a death sentence, and there was less talk about HIV because it was still progressing. I grew up in the 80s, so that was a big concern of my family when I came out. Like, don't get sick. I was like, great, I'm not having sex with anyone, but thank you for the concern. And given that who I am as a gay man and the work that I do, queer health, I feel like I know the progress we've made fairly well, but I still don't think most people do. They don't have that opportunity necessarily, which is possibly why we have things like HIV criminalization. And I am no lawyer, I am no expert, but we can't criminalize people for not disclosing. As Dr. Dryden said, we know that Black and Indigenous people are disproportionately affected by HIV criminalization. So the HIV Legal Network did a study, and in a 4-year span, 2012 to 2016, half of those people charged with a sexual assault because of HIV were Black men, and 38% of the women charged were Indigenous. So we really have to consider how the structural barriers are playing out and marginalizing people even further. And then finally, HIV stigma and quite frankly, sex negativity. So HIV is a medical condition, but we obviously have made light years of progress from where we were in the 80s. And yet we still have shows like 13 Reasons Why, which I have not watched, but I have had lots of people tell me that in the most recent season, they treat HIV as some rapid onset disease that leads to death. And with a target population of mostly youth, this is horrifying to me. I spoke to a sexual health educator in the last 2 years who said that they still need to teach high school students on a regular basis that you cannot get HIV from a drinking fountain. This is like the thing that I learned in 1988 when I was like 11 years old, and we're still teaching it. And we hear the stigma for all STBBIs when people describe themselves on dating apps as clean, as implying that people who have HIV or other STBBIs are dirty. And for a community that is allegedly sex crazed, I'm talking about gay men here, we sure do a lot of slut shaming and sex shaming going on. And I think one last point that I noted down before I forget, for PrEP, we do tend to also focus on the cis white gay guys who use it, but it is not just for those people. It is for couples sometimes when, for whatever reason, one of the partners is HIV positive and cannot achieve the undetectable level. It is for people who are sex workers. It is for trans people. We have to get this narrative that PrEP, which I'll just clarify for those who don't know, is pre-exposure prophylaxis for HIV, is basically a medication that people who are HIV negative take on a regular basis to prevent receiving being transmitted HIV through sexual contact primarily, although there is lots of data that it works for injection drug users as well, and not as powerfully. We have to get off this narrative that PrEP is just for the white cis gay guys. And also just one last shout out, because I'm sure I didn't say it, I believe that you have a survey going on right now on Got Blood to Give. So if you are a Black queer man who has sex with men, I can't remember the full study, in Canada, anywhere in Canada, shouting out to everywhere across the world, for Canadians, just Google Got Blood to Give.
Awesome. Thank you so much. I've made some notes throughout because there's so many really important topics that each one of you brought up and things that I really want to highlight. Kirk, when you were speaking, it reminded me of doing the work that I did last year. One of our participants, because we did focus groups all across the country, and one of them, I somehow got this meme, and it's from one of the people that participated, and it said, "It's not the virus that's killing me, it's the stigma." And I think that's really the focus of what a lot of the work that we do is on the stigma. It's not on the virus itself, it's not on the medical aspects of it, it's treating the stigma that people have, and it's ridiculous. It's ridiculous. There's no need for the amount of stigma and sexual shame that goes into it. And even when we talk about PrEP, and as somebody that uses PrEP, there's a lot of stigma and shame that's on that too. And people think you're automatically like a whore, or that you're having all this unprotected sex, or like, no, honey, not all of us are. Excuse me. I mean, I wish, but like that's not the case. So I think we really need to get past, what medications people are on or what they have, and really start educating ourselves and learning, not just, judging people. And, we talk about this when we talk about BLM, when we talk about HIV, when we talk about so many other topics, even being queer. I mean, look at how many people judge us just for being queer, let alone being queer and Black and gay and like all of these, so many layers of stigma. Educate yourselves. It's not that hard. Educate yourselves and actively work against hate. I mean, that's essentially what it comes down to. And there's another quote that I really love. It's from a video I normally show in a presentation that I do. And it's, so Bruce Richmond, who started the U=U campaign in the US, you can check it out, has great resources, preventionaccess.org. He's amazing. I met him last year. And today, funny enough, is actually the 4th year anniversary of the start of that campaign in the US. So shout out to Bruce. I know you're not gonna be watching this, but Bruce is an absolutely amazing individual and has done global work on U=U, and it's been translated into so many languages all throughout, and it's just amazing. So the quote is, God, now it's gone. Hold on. The time for excuses is over. And I think it's so simple, it's so succinct. The time for excuses is over. And we can use this for any one of these things that we talk about, talking about education, talking about stigma, talking about U=U, talking about, Black Lives Matter and all of the discrimination and racism and everything that we all experience in different ways. The time for excuses is over. Stop it. Go educate yourselves. I love that Kirk talked a lot about PrEP as well. I love that you bring in so many stats. I mean, normally, like, I'm definitely a big nerd, so I love hearing stats. And, the Sex Now survey, check out the data is all online. You can do it geographically. It's a really amazing resource. If you're curious about your region or all of Canada, go check out that as well. I'm sure you can talk about that.
It's ourstats.ca.
There you go. Amazing. It's an awesome resource, particularly if you want to learn more about that. Yes, so PrEP, pre-exposure prophylaxis. It's, very well tolerated. It's 1 pill a day. And a few things with that in this province. So I recently moved from Ontario, and I'm going to call out the government here because, well, most places in Canada, it is not covered by provincial healthcare, and it really should. We really need not only provincial pharmacare, but national pharmacare. And, the people that are most at risk are the ones that can very often not afford to take it or may not have personal insurance that would also cover it. I work in nonprofit. I do not make very much money. I need, thank God I have some insurance, but it is really expensive. It can cost anywhere from $250 to $1,000+ just for PrEP, let alone, ART or antiretroviral therapy. If you're living with HIV, that can be incredibly expensive. These should all be free. And thank God ART here in this province is covered, but PrEP should also be covered. We need to start focusing more on prevention as treatment, not just treatment itself. And, a lot of our health systems are very reactive. They are not preventative. And I really want to make that point as well. Learn more about PrEP. It's also on the ACNS website, acns.ns.ca. We have lots of information. We have information that you can send to your GP, to anybody you're talking to. Also, shout out to the Halifax Sexual Health Center. We send you people all the time. I'm sure you're overrun with people, but they are an amazing resource. And, they do have doctors that can prescribe PrEP. They have a lot of information about PrEP. Check them out as well. Yeah, those are a lot of the points. And I love, Kirk, that you also brought up that U=U is not the only thing, that we also have to talk about the third U. I love your third U. It's great. I have a different one. I say that it's universal. So we need universal access to prevention, access to testing and treatment, and also, universal information, not just for people living with HIV that can become undetectable, but for everybody that can't become undetectable. You know, about 10% of people living with HIV cannot maintain an undetectable viral load, and we can't shame them further by being like, oh, you need to become undetectable. That's the only goal. That's the only way to live with HIV, and then further stigmatize them, even within an already multiple marginalized community. You know, we really need to reduce that shame and that stigma if you can't become undetectable. So those are a lot of the things that I want to talk about and that you all prompted for me. I think maybe we can go around if anybody has anything that they would like to talk about, or anything that I brought up, or anything that, you know, anything, Deva?
Nothing really for me. I mean, you guys have brought up all of it. There's absolutely nothing I could absolutely add to this. I mean, I only have my personal experiences to go off of. I mean, I've been involved with the ACNS and worked with them in previous years, and we still have work to do, and we always will have work to do, I guess, until balance is achieved, I guess.
Yeah, thank you so much. Also, you look stunning.
Thanks.
And also check out Queen's Ranting. It's amazing and hilarious. If you haven't yet, Queen's Ranting is amazing.
On Station DRG on YouTube. That became my focus. That's really how that started, was all of this. That's how that started. It gave me a place to put all of that anger and shame of myself and everything, and that I have no problem admitting that show saved my life.
Yeah. And you and Rouge do such a fabulous job. So, OmiSoore, do you have anything to add, or lots of things?
I was just checking the time. Can you hear me?
Yep.
Okay, great, thanks. So I just wanted to say a couple of things. I agree with Kirk that Canadian Blood Services is one of the most sex-phobic organizations I've had to work with for a long time. And I have lots of stories about that, and I'm happy to share a few. But I do want to once again state that PrEP is not easily accessible to people. If we think about Nova Scotia, predominantly, there's lots of people who live in rural communities, and there is, I don't even know what the number is now, people who don't have primary care physicians. And as great as the Halifax Sexual Health Center is, and I work with them on Got Blood to Give, they don't have dedicated programs for Black people or Black, queer, and trans people. And getting access to that information, even online, can also be a barrier. Not because, as we found out during the pandemic, there are lots of communities in Nova Scotia that are using dial-up because there aren't cell towers. And so not simply because we can't even access the internet, but also some of that information is written by white people for white people. And I think, it's important to say that often, that the message is not universal, that the message needs to be culturally appropriate. And so, just a quick search on research in terms of Black gay and bisexual men, or Black men who have sex with men, and the uptake of PrEP. You don't have those studies in Canada, often because Black people aren't thought of as an appropriate group with which to work to do these studies. And so you have to look at the studies in the United States and the UK. And then the studies in the United States and the UK state quite clearly that the barriers to accessing PrEP are racist stereotypes, racism as a social determinant of health, not having access to a primary care physician, not being able to afford the medication, and then also dealing with the kind of racist stereotypes that continue to exist within gay and bisexual communities and LGBTQ communities. These are barriers to accessing PrEP. And then the kind of racist stereotypes around Black people being hypersexual, and fetishized in various, sex communities. And then what Kirk was saying about the ways in which sex workers and drug users and folks who are street involved are often marginalized within our communities and thought of to not be worthy of our time or to be the center of this work, And, Global News the other day posted a clip of Sylvia Rivera's rant at one of the early prides in New York. And I think a lot of what she said there is very relevant to what's happening here. In terms of sex phobia and Canadian Blood Services, Canadian Blood Services said at a meeting in 2017 that they didn't think it was appropriate to ask people about their behavior because they couldn't understand, they couldn't bring themselves to ask the 72-year-old grandmother about the last time she had anal intercourse. And it told me so much about the person who said that. I was just like, wow, you really have boring sex, because they just couldn't imagine this of anyone else. And they self-identify as a woman and they're cis. But the other reason was, why are you trying to sex shame Grammy? Like, why don't we believe that? Number two, why do you think 72 is old? Shut up. And why don't we believe that at 72 and beyond, like, let's think about Ruth Ellis. Ruth Ellis was the oldest out African-American lesbian. And so when I say African-American, I actually mean in the States, African-American lesbian. She lived to 101 years old, right? And so Yvonne Wellman did a great film on with Ruth Ellis. So look up Yvonne Wellman and look up Ruth Ellis. And in that thing, Ruth was like, listen, I was having sex at 95, I'm good. And so this idea somehow that Grammy at 72 wouldn't be throwing down and having, anal intercourse is ridiculous. And the idea somehow that simply by being a man who has sex with men, that you are, protected, monogamous, whatever, is more of a challenge, more of a danger to transmitting HIV than straight folks who are, throwing down with each other in many, many, many ways. And I'm not trying to shame them in any way, shape, or form, but you're not asking them about their sexual practice. This is a problem. This is a huge problem. And if Canadian Blood Services had actually started to do that in 1998, where we would be today around understanding the ways in which behavior, unprotected, anal, vaginal, front hole, back hole kind of sex, where we would possibly could be around making sure there were more safe injection sites, all of these things that could happen. Maybe they would even have redesigned their clinics to have physicians on site to provide health education and information. Blood donation could look very different, but Canadian Blood Services was so committed to a really conservative, homophobic, racist, sex-phobic model that we find ourselves where we are today.
I also really like the idea of the 72-year-old grandmother being confused by that question. She's like, wait, do they mean receiving or giving? Because I peg my husband all the time.
This is what I'm talking about, right? Oh my God, they told me so. I was like, honey, did you really mean to tell us all of that about the way you having sex? Did you really mean to share that with all of us? But
Yep. We do have a couple of questions. Kirk, if you want to go first for a couple of minutes, and then we'll hop onto those.
Sure. Okay. Well, it depends on what the question. Oh no, the only thing I want to say is the way we've responded to COVID is an imperfect example of what happens when a matter is given priority. Like the government response at the provincial, municipal, federal level has been far from perfect, but it shows that, when we treat something as a priority, we can do the work. I do think that HIV is seen less of a priority issue nowadays. Absolutely. But the fact is, treatment is prevention. Education is prevention. A lot of the work I do has this idea of combination prevention, that you can't just give out condoms. That's not enough. You have to attack this issue from multiple perspectives. And Nova Scotia, as far as I know, Deva could speak more of this directly, is pretty good for providing treatment for HIV positive people, but far from perfect, right? And it also is very siloed and stigmatized. I do have friends who are HIV positive who've had the experience of going to their doctor and saying, listen, this is a health concern. And they're like, oh, you're HIV positive. You should see an HIV specialist. How does that have to do with my broken ankle?
Yeah, 100%. So I'm just going to go through a couple of last points here, and then we can share a positive message and one thing that we should do moving forward as a group. So I'll go around after. One of the things that you said, OmiSoore, talking about things that make us uncomfortable, particularly when it comes to sex. I love making people uncomfortable. My existence, like me walking down the road in heels and a queer mullet, like I push people's boundaries and I love it. I love that I am gender fluid and that I can own that and that I have the confidence to, but a lot of people don't. And I think we really need to lean into what makes us uncomfortable. And again, educate ourselves and learn from people. You know, there's so much information and amazing people out there like the folks here that's I really wanted to make that point. Rural access, you brought that up as well, and multiple people have brought it up. We have so little funding and so little access to people, for people that are living in rural areas, not only to treatment, not only to medication, but even testing. I think we need to fight a lot for more testing sites, rural testing sites. We need more funding. We need take-home testing kits for HIV to be available here. We need so many more things. I can talk about that all day. It's literally what I do. You know, you talked about that a lot of the services that we have are gay and bi specific, and this drives me insane. As somebody that identified as a gay person, that was like semi-fine, but now as somebody that works, you know, in HIV, and I do a lot of work, not only locally, but provincially, and I'm involved in some national work. Most of it is gay and bi focused. And I'm like, okay, I'm gender fluid and queer and don't identify as a cis man. So where the F do I fit in? You know, how I feel like I don't exist. And, you know, we talk about so many people's identities and erasure and, you know, so many times people that identify differently don't exist. And so I think we really need to like keep that in the back of our minds as well for people that are not gay and bi. Start doing better. Do more work for trans, gender fluid, non-binary folk. We need it so hard. Yeah, so that's all the notes that I have. We do have two questions. One is from Taylor Jeanette, iCarly. That says ART. What is it? So ART stands for antiretroviral therapy. It is the drug that people living with HIV take every day that can reduce the viral load in their body. Yeah.
There's lots of different ones.
Yeah. And that's how you can potentially become undetectable. And another question from Jad Sino. On the topic, oh, hey, Jad. On the topic of PrEP, can folks comment on the overwhelming incompetence of healthcare providers regarding PrEP and PEP? One of the biggest barriers to accessing TASP or TASP is poorly educated physicians. Oh my God, yes. I think we could all talk. We could have another full panel about that. I mean, even from my own personal experience, so many people just do not know. So many people in the healthcare sector do not know, still have a lot of that stigma, and just ask so many inappropriate questions or have no idea at all what PrEP even is. You know, we need information and education for every single healthcare provider while they're in school. And, you know, I thank God for Kirk. Maybe you can speak to that as we go around to the end. You know, doing amazing education work for healthcare providers on PrEP. Yeah, if you want information, visit acns.ns.ca. We do have information that you can bring to your healthcare provider if they don't know anything, or if you think they're awful, be like, here you go. You don't have an excuse. Here's how you can get informed. So if we could just quickly go around and say kind of some last thoughts. Deva.
My last thoughts would be education, because as someone who now has a host full of 20-year-olds who, I'm not going to lie, are sleeping with everything, they have forgotten that HIV exists. And they come home and tell me these horror stories. I'm like literally pulling my hair out. I'm like, yeah, mommy's going to have a conversation with you someday. I know it's going to come, right? So yes, I am completely for increase the education, get it back in the schools. People don't know enough about it. And AIDS and HIV affects everyone. It is not just cis white men. It is not just gay men. Anyone can get it. It has no boundaries. And continue with the great work. I think you guys are doing awesome work. This makes me very sad with Dr. Owen to know I've never heard those things, right? And that I've never known that I didn't have access to drugs. When I first became positive and found out, oh my God, like my medication for 3 months is over $3,000. Like, how does someone afford that when they don't have healthcare or they don't have access to this? So we have so much work to do to bring us up to any kind of a balance with the world today. And like you said, COVID taught us that if we do pull together, we can bring everything together. But because HIV is not the current thing on social media, nobody cares about it, right? So people are forgetting about it. And I love Dr. O. I could sit and listen to you talk all day. Thank you so much for being here.
Thank you. Just some last quick thoughts from OmiSoore Dryden.
Oh, I'm on. This is what I would say. COVID taught us a lot of things. And what it taught us is that if you're not specifically collecting data, disaggregated race-based data, then you don't know what the experiences are for Black people. And so we still don't know what the experiences are for Black people in Canada, and specifically in Nova Scotia, because the province refuses to collect disaggregated race-based data. The other thing I would say is thank you. It was great being on the panel. And the last thing I would say is Black queer lives matter and Black trans lives matter.
Thank you so much. And last of all, Kirk.
Thank you all for being here, both the people watching at home or at work, and the panelists. We have come a long way, and we need to recognize and celebrate that, especially celebrate the people who have laid down the pathwork for us. There is still a long ways to go, but we've got great people doing it. There are initiatives. As to Jad Sinna's question, yeah, it's training healthcare providers is always a challenge because you can't make doctors do anything. There is a training opportunity coming up for primary care providers next month who want to prescribe PrEP, but it still doesn't address the fact that a lot of people just can't afford it.
Thank you so much. For more information on the work that I do, check out acns.ns.ca or any of our social media. Thank you so much, everybody, for being here. This was absolutely my pleasure.